How would you feel if you knew that your doctor hated their job? Like, really hated going to work every single day in order to help you. You might wonder why this is a problem, but it affects the patients. It affects you as a person getting treated by the doctor if they hate their job, if they hate going to work every single day. Guys, I just spoke to two different doctors today. We were talking about direct primary care, and you could just tell they were burned out even after just maybe 6 months of working in the system in the traditional primary care world. One of these doctors was promised 20 and 40-minute patient visits, 40 minutes for new patients and 20 minutes for follow-ups. And what ended up happening was that 6 months into his job, the administrative staff said, this isn't going to cut it. We're not making enough money. You need to spend 20 minutes for every patient no matter what. And I actually was surprised at this because I was used to seeing patients every 15 minutes when I was working in the traditional primary care world, which meant that I really only got to sit down with a patient for maybe 5 to 7 minutes in total, and then had the rest of that 15 minutes to work on their chart, to work on their prescriptions or whatever else they needed. It's just such a broken system, guys. And the person who really suffers in the end is you as the patient. Because if your doctor hates their job and hates going to work every day, it makes it really difficult for them to care about their patients, even though they really do care about their patients. I sat down with two doctors today, and the main question I had for both of them was, what is your perfect scenario as a doctor? What do you want out of your job? And they both said the same thing, which is what I would say too. They both said, I just want to take care of my patients. I just want to actually have the time to care about my patients. I want to sit there and I want to get to know them, and I want to learn everything about them that allows me to take care of them the best way that I know possible. But I can't do that in a 20-minute initial patient visit. I can't get to know them. One of these doctors recalled a new patient visit that he had, and the patient was scheduled to establish care and talk about her back pain. She was having some back pain, but she clicked the wrong type of visit that she was there for. She clicked the Medicare wellness visit. If you guys know anything about the Medicare wellness visit, it's something else. It's a list of things that your doctor and you have to sit down to go over, including your vaccine status, your fall risk, your nutritional status. I'm making it sound better than it is. It's not a great experience for the patient or the doctor because it's just a packet. It is literally a packet that you fill out. That is a Medicare wellness visit. But it has nothing to do with true medicine, true caring about the patient. I mean, it might, but I don't remember being fond of these visits at all. And that doctor didn't either. He had wanted to meet the patient. He wanted to get to know her. He wanted to help her with the problem she was there for. But he couldn't do that because they were scheduled for a Medicare wellness visit for that hour. He had to have the patient come back the next day in order to help her with her back pain and get to know her. But that's the traditional system in a nutshell. Most of the time, you can see your doctor for 1 or 2 problems max. If you get a third one in there, you're really lucky, and that doctor is giving you a freebie. So they're only really supposed to be able to bill for 2 problems in one visit. Otherwise, you got to come back. And this is frustrating for patients, but this is incredibly frustrating for doctors too. All they want to do is take care of you, and they can't. Their hands are tied. The insurance requires them to do things in a very specific manner. They get to tell them what to do and how to do it. They get to tell them what prescriptions to give out. They get to tell them how to spend their time. They make them jump through so many hoops to get certain prescriptions covered. If you've ever heard of a prior authorization, it's tiring. Why can't a doctor just say that they want a certain prescription for a certain patient? It's not a waste of money. It's trying to actually help somebody. And if you've ever felt rushed through your visit or like you didn't get any time with your doctor, it's because your doctor didn't have any time for you. And that's the system's fault. That's not their fault. They're forced to see 30 patients a day. How can they take care of 30 unique and new problems every single day in a short period of time? One of these doctors that I interviewed today, he asked about why the push for 20-minute visits because he wasn't sure that he could keep up with this. The person who was in charge of the scheduling told him, you're just going to have to get used to falling behind as a doctor. That's what they do. So you can see how this problem trickles down to you as the patient. If the doctor's pressured to see 30 patients a day, they don't have the time to do it, they don't have the time to do their administrative work, they don't have time to go home and spend any time with their family, then they're burned out, and this trickles down to you as the patient because by the time they get to you and your concerns, they don't care anymore. And that's the sad truth of it. And I'm sorry. Really, they all want to care about people. They all truly got into this to do things the way they were meant to be done, and they can't. And it's a problem for you, and you should care. And this brings me full circle to talk about the same problem that I'm going to talk about in every video that I make, is that you should really advocate for having a doctor who actually has not only the heart to care about you, because most doctors have the heart to care about you, but it's the time, it's the energy, and it has to be either given to them or they have to fight for it. Okay, guys? And you can support your doctor to have that time and that energy and that heart for you by paying them directly. I know that's hard for some people to accept, but in my world, in the direct primary care model, we try to make it really easy and affordable for our patients to be able to come and have access to us as providers. It's a membership model. You're gonna pay about $1,000 for the whole year, give or take some, but it's not designed to drain you of your finances. It's really designed to be able to support the provider and their staff to help you the right way. At my clinic at Prime Direct Health, we have a stake in the ground, and we have decided that the most important thing that we are doing is caring for our patients. The patient is always number one in our business model. That's why we're doing what we're doing. It's everything to us. The patient's being cared for and the patient experience. And so I think it's worth every person out there who needs help, who needs a doctor of some sort, who needs prescriptions or help with their mental health or help with their health anxiety, anything that you need a doctor for more than 2 or 3 times a year, maybe more than once or twice a year, seek out somebody that you can pay to support to be available for you with their time, their energy, their emotions, their heart. Doctors really do care about their patients. It's the only thing that matters to them. If we can spend a day helping people, truly feeling like we make differences in people's lives, we're fulfilled. And that's all that matters in the end. If I haven't convinced you yet, think about who you're really supporting when you're using your insurance for things like primary care, because insurance exists for a reason, and I think that it should exist for emergency care, specialty care, things that cost more than $1,000. But for primary care, it really doesn't need to be insurance driven. When you're using insurance for your primary care, you're paying those premiums, you're trying to nickel and dime insurance for whatever you can get out of them. It's because your premiums are probably really high, you don't have a high deductible plan, and this doesn't apply to everybody. But when you're supporting insurance and using insurance for every single little thing, you're supporting the system that's burning doctors out to not have time for you and not care for you. So really, what are you doing?